The Population Foundation of India, PFI, is the result of the vision of two remarkably philanthropic corporate captains, Bharat Ratna J.R.D. Tata and Dr. Bharat Ram, who realized as early as 1970 that a healthy population is essential to inclusive growth. In the 1970s, the government of India worried about development not keeping pace with a rapidly increasing population. It was at that time that PFI began to conduct its own field research. The foundation carried out extensive research on the reasons for India's massive population growth rate. Its findings over the years showed that for success, it is not just about trying to limit the numbers. It is also about improving the quality of life. There is need for alternative methods and choices to be made available to motivate people to care more about their reproductive health and the health of their families. The Founding Fathers believed that family planning should not solely be the concern of the government. Its efforts should be supplemented by private voluntary enterprise. PFI therefore began with a handful of people with two primary means of working: to be a donor and give out small grants to NGOs and corporates to initiate innovative reproductive health pilots, and to be an implementing agency for population stabilization programs using national and international grants. Over 40 years, it has expanded to an institution with a presence in 20 states, with 13 state offices, a staff of over 100 professionals, and in the last 4 decades, PFI has partnered with over 350 institutions, NGOs, corporates and government bodies, both central and state.
ये 100 नंबर के चित्र से आपको कुछ दिखाई दे रहे हैं? बोलना, शर्माना नहीं है.
PFI's dominant aim is population stabilization through gender-sensitive and rights-based interventions at the grassroots. PFI helps people think about a better quality of life in various ways. It introduces concepts of reproductive health and family planning to communities who have never known until now that they have choices available to them. Today, PFI is advisor and consultant, researcher and planner, an advocacy partner for the community through its partner NGOs and corporates. For PFI, reaching the communities is the result of thorough research, analysis and innovation. Sometimes it's a radio program that answers the quietest questions.
मैं बबली बोल रही श्वेता संघ आटी से हूँ. 4-5 बच्चे तो होते हैं गांव में, लेकिन मेरे लड़का लड़की 2 ही है. मैं उनका जन्मदिन भी मनवाती हूँ और लड़की को हॉस्टल में भर्ती किया पढ़ने के लिए. 7वीं क्लास में पढ़ती है. तो मैंने सोचा मैं ना पढ़ी तो कुछ नहीं, उसको पढ़ के कुछ बनाना है, मेरे को आगे बढ़ाना है.
Or it may be community theatre that inspires everyone to adopt healthy behavior. In a myriad ways, PFI programs reach the housewife, speak to the adolescent, reassure the mother-to-be, sensitize the men, and inform the uninformed. No one is left out. Empowering communities to monitor and plan increased access and quality of health services under the National Rural Health Mission has been a pioneering effort with support from the Government of India. It began with a pilot project across 9 states and is now making communities hold their local governments responsible and accountable for providing quality health services.
So how important is is to go to the doctor timely. That is all.
PFI offers expertise in management, research, advocacy, and capacity building in dealing with communities, including behavior change communication. The training enables NGOs, governments, and corporates to achieve their goals. A good example is a project reaching remote villages in Rajasthan's Sirohi district. Many bumpy and potholed miles away from even the rural road networks, the population is largely tribal. PFI structured a corporate social responsibility program in partnership with JK Lakshmi Cement on reproductive health.
As far as JK Lakshmi Cement is concerned or JK organization is concerned, we very firmly believe that if we have a factory area, so we have to look after the nearby areas. Why we chose PFI? Because I thought that they were very professional and they were very reputed NGOs, and their focus was on mother and child projects.
Over a period of 6 years, there were dramatic changes in these villages in Sirohi, where in large parts of Rajasthan, 650 of every 100,000 women die of childbirth. After the PFI JKLC intervention, not a single mother has died whilst having a baby. Also, the acceptance of family planning techniques went up 4 times, from 5 to 20%.
मुझे HIV/AIDS के बारे में कुछ पूछना था, अगर कुछ कि हम किसी को बता सके.
PFI also stretches its resources outside of rural areas to reach within the hearts of cities with much needed life skills education to adolescents and reproductive health care for the young people in urban slums.
एकदम तो खत्म नहीं होगा ना, हम धीरे-धीरे एक कोशिश कर रहे हैं जिसकी वजह से ये धीरे-धीरे कम हो रहा है.
Smile was anyways intervening in urban slums and taking a lot of initiatives as far as empowerment of girl child is concerned. So PFI joined hands with us in 2007 as a technical and financial partner. Together both the organization then thought of this goal that something should be done for the health and empowerment of women.
More a systematic approach to scaling up.
PFI is only too aware of how much more needs to be done. Many programs achieve success as a pilot. However, if they are to expand their base or scale up their activities, specialized management expertise is required, a role that PFI is now able to fulfill. A good example is the work with the Karnataka-based Karuna Trust.
When we started this public-private partnership with Karnataka government with Primary Health Center, there was no money for capacity building, monitoring, supervision, all those costs, additional costs. PFI team all together helped us to improve our organizational development to prepare for scaling up.
The pioneering work being done in the area of primary health is something that PFI, with the support from the MacArthur Foundation and Management Systems International, has helped systematically scale up to a nationwide program for change in the most inaccessible parts of the country. In Orissa, in Arunachal Pradesh, Chhattisgarh, Assam and Jammu and Kashmir. Donor commitments are vital to PFI's work. The John D. and Catherine T. MacArthur Foundation funds maternal and child health programs across India.
And the reason we chose PFI is one of the solid organizations with a history of 40 years working on population issues in India.
PFI's core strength, advocacy, has made it successfully campaign for change to come from working with communities, to make them aware of their needs, rather than telling them what to do. In the last few years, PFI's substantial work in advocacy, its rights-based and gender-sensitive approach has been supported by the David and Lucille Packard Foundation.
The Packard Foundation's reason for deciding to choose PFI as one of its important partners, especially around advocacy on population and reproductive health issues, is because as we looked around the country, we found few institutions that shared the kind of passion and commitment that we have to the issues of population growth and women's sexual and reproductive health.
Crucially, PFI's role in HIV and AIDS is supported by the Global Fund to Fight with AIDS, Tuberculosis and Malaria. It consists primarily in providing care, treatment and support to people living with HIV and AIDS. In fact, the Population Foundation of India is the first civil society group in India to be the principal recipient of a Global Trust grant. PFI is now responsible for the implementation of the program in 14 states in the country. The Population Foundation of India is an institution that believes in change of the people, by the people, and for the people. Its work with communities, governments, NGOs, corporates and other institutions are all tied together to help people help themselves. With more corporate and institutional support, PFI's work of national importance can be scaled up and expanded to benefit the neediest.
Over the last few years, the entire community of civil society have started looking at PFI from that lens. That PFI is a rights-based organization, is a gender-sensitive organization when it comes to population stabilization efforts.
4 decades ago, 2 corporate visionaries endeavored to change the way India cares for its people and co-opted many of their peers along the way. Let's rededicate ourselves to renew that effort.